In 1980, the average American spent about $1,100 per year on healthcare. Adjusted for inflation in today's dollars, in 2026, that number is over $13,000 per person. That is more than a tenfold increase. In roughly the same kind of medical care your parents received. In roughly the same kind of country. And the difference has nothing to do with people getting sicker. Nothing to do with treatments getting dramatically better. And nothing to do with doctors making more money. It has everything to do with a structural redesign of how healthcare gets paid for, priced, and profited from. A redesign that turned your body into a tradable asset class, where the only thing that did not appreciate was your actual health. A redesign nobody officially announced, and almost nobody has explained clearly, until now. The popular story about American healthcare costs is that medicine is expensive because it is so advanced. We have MRIs, robotic surgery, new pharmaceuticals, and that miracle technology has to cost something. And in a narrow sense, that story is true, but it does not explain why a single Advil at a hospital costs $25. Why insulin priced at $3 in Canada costs $300 here, or why a basic ambulance ride costs $2,000, when the actual technology in an ambulance has not meaningfully changed in 40 years. The reason is that American healthcare stopped being a service industry decades ago. It became a financial industry. That happens to involve doctors. And once you understand that shift, you will never look at a medical bill the same way again. So it is time to learn how money works, to find out why your health became someone else's portfolio. Okay, so the first thing to understand is that in a normal market, prices are set by what buyers and sellers agree on. American healthcare does not work like that. When you walk into a hospital, you almost never know what anything costs. The hospital does not know what they will be paid. The insurance company has a secret negotiated rate. A pharmacy benefit manager has a separate negotiated rate. The actual prices on the bill are numbers nobody actually pays, designed primarily to anchor your understanding of how generous your insurer was when they negotiated them down. This is what economists call price opacity. What it means, in plain English, is that nobody in this transaction is trying to find the actual cost of providing care. Everyone is trying to extract the maximum amount possible from someone else in the chain. You, the patient, are the end of that chain, and the chain has been getting longer every year for 40 years. Which brings us to problem number 2. For most of the 20th century, healthcare was paid for in a relatively simple way. A patient saw a doctor, the doctor charged a fee. The patient, or their employer, paid the fee. Today, between you and your doctor, there are insurance companies, pharmacy benefit managers, hospital administrators, billing departments, private equity firms that own the doctor's practice, holding companies that own the private equity firms, and Wall Street investors that own the holding companies. Each layer takes a cut. Each layer needs to justify its existence by extracting margin from the next layer. The result is a system where the actual care provider, your doctor, receives roughly 8 cents of every dollar you spend on healthcare. The other 92 cents goes to layers that do not touch you or treat you, and that did not exist in this form 50 years ago. Healthcare in America is not expensive because medicine is expensive. It is expensive because the financial layers built on top of medicine are extracting roughly 12 times more value than the medicine itself. And this brings us to the third problem, which is the one that closes the trap. For most major purchases in your life, you can choose not to buy. You can wait for a better price, find a cheaper alternative, or simply go without. With healthcare, you cannot. If you need an emergency appendectomy, you do not have time to comparison shop. You do not have leverage to negotiate, and you cannot legally decline to buy the service once you are unconscious on the operating table. This is what economists call inelastic demand. What it means, in plain English, is that the buyer has no power, and in any market where one side has no power to walk away, the other side gets to set whatever price they want. The healthcare industry knows this. The insurance industry knows this. The pharmacy benefit managers know this. The financial investors that bought the hospital chains know this. And every product, every premium, every billing decision is engineered around the fact that you legally and physically cannot say no. Now here's the part. Nobody at any major insurance company really wants to say out loud. American healthcare is not just expensive by accident. It is one of the most profitable industries in the country. The 10 largest American health insurance companies generated over $180 billion in profit in 2024 alone. That is profit after they paid for every claim, every administrator, every executive bonus, every lobbyist. The hospital systems are even more concentrated. 3 private equity firms now own roughly 30% of the emergency room staffing in this country. Pharmaceutical companies routinely report profit margins. That would be illegal in any other regulated industry. The system isn't broken. It is working exactly as designed for the people who designed it. The fact that it makes Americans pay 2 to 5 times more for healthcare outcomes that are statistically worse than what people in every other developed country experience is not a bug. It is the entire business model. So when someone tells you that American healthcare is expensive because it is good, they are not lying, exactly. But they are also not telling you the whole truth. The medicine is fine. The technology is fine. The doctors and nurses are good and getting paid less every year. What is expensive is the system of financial intermediaries that has been built on top of all of it, and that has spent decades engineering itself to extract the maximum possible value from a population that legally cannot refuse to pay. The harder you work to stay healthy, the more you realize that staying healthy in America is a financial strategy, not a medical condition. That is not a personal failing. That is the math of a healthcare system that was redesigned to treat your body as an asset class. If you want to understand exactly what your insurance company does with the premiums you pay them every month, go and watch this video next. And don't forget to like and subscribe to keep on learning how money works.